This presentation is a general introduction to stress management. The presentation should be used for information purposes only. The content should not be considered as medical advice, and nor should it be used as such. For information related to your circumstances, please contact your Cardiac Rehabilitation team or General Practitioner. Aims for this presentation. We shall be looking at increasing your understanding of stress, its causes, and why it is one of the risk factors for cardiac disease. In the second half of the presentation, we look at techniques and strategies for minimizing the effects of stress. We all experience stress differently in different situations. Sometimes we might be able to tell right away when we're feeling under stress, and there are obvious reasons why, such as moving house. But at other times we might be just as stressed, but we keep going without recognizing the signs. Stress can affect us emotionally, physically, and the way we behave. Some common features of things that can make us feel stressed include experiencing something new or unexpected, something that threatens your sense of self, like being diagnosed with a long-term condition, or feeling you have little control over a situation. However, a certain degree of stress is a normal part of life. This picture is known as the stress performance curve and shows how a certain amount of pressure or stress can put us in a state of optimum performance. Sometimes, for short durations, we can work with higher levels of stress, for example, when sitting an exam or a busy period in work. Stress that goes on for too long, with no end in sight and no respite, can lead us into the red shaded area. This is when we may start to feel anxious, our sleep may be affected, we lose our temper more easily, and our relationships may suffer. It is essential, therefore, that we take notice of what triggers our stress and can recognize signs and symptoms in ourselves before we get into the red zone. There are many things in life that demand our time and attention. The problems start when we feel that the demands are mounting up on us and we don't have the resources to cope or buffer the effects of these demands. Resources that you might have available to you are the listening ear of a friend or a coping strategy that calms you down. However, sometimes our coping strategies don't work, or we bury our heads in the sand, stop talking to people, and avoid doing things that might be helpful. Before long, we might find ourselves in a state of stress where we feel completely overwhelmed and are struggling to cope. So what is going on in the body when we get into this state of stress and feel overwhelmed? We rely on our autonomic nervous system to regulate involuntary physical processes, including heart rate, blood pressure, breathing rate, and digestion. But let's skip back 2,000 years and think about the kinds of stresses that our ancestors had to deal with. Their main concerns were about safety, fighting, defending their family, and hunting for food. And their autonomic nervous system was a finely tuned instrument enabling them to survive. When we are in danger, our bodies can instantly go into fight or flight response without us having to think things through. The sympathetic branch of the autonomic nervous system, or ANS, is ready to ramp up the body's response to help us escape or fight. And when the danger is past, the parasympathetic response, or rest and digest mode, kicks in. So what is happening in the body when we go into fight or flight? The following changes happen automatically. The pupils dilate to help you see better. You may experience a dry mouth as there is a decreased flow of saliva. The heart beats faster and harder to pump blood containing oxygen and sugar to your major muscles to use for energy. and the blood pressure increases. Gut activity slows, and you may experience butterflies or nausea. Your breathing rate increases and your airways dilate. More oxygen enters your blood. Your hearing and all of your senses become more acute. Mental activity and alertness increase for quick decision making. The adrenal glands release adrenaline and cortisol and other hormones, which is all regulated by the sympathetic nervous system. The fight or flight response is a normal and necessary response to danger. It triggers our nervous system to make more white blood cells, and these cells can help us fight off infections and wounds, but when it is caused by modern-day stress, we increase the number of cells that make our body inflamed. The white blood cells born of stress may also be more inflammatory than usual and bad at receiving anti-inflammatory signals that naturally hold our white blood cells in check. In the next slide, we look at other responses that you might recognize in yourself. Having a heart attack, heart surgery, or being diagnosed with a new heart condition is a stressful life event and can affect people psychologically and emotionally, as well as physically. We know that following a heart attack, most people have a raised adrenaline level. There can be worrying thoughts such as, I'll probably have another heart attack, or I won't be able to get back to work. Often these thoughts, or perhaps a memory of your heart event or time in hospital, will go through your mind so quickly that you are not even aware of it. But you might well get the feeling it produces in your body, and this is the effect of adrenaline. All of these things are normal and should lessen with time as the months go by. The British Heart Foundation surveyed nearly 3,000 people with heart conditions and found that more than two-thirds, 68%, said their condition had affected them mentally, emotionally, or psychologically. Of those who said their heart condition had affected their emotional well-being, anxiety was the most common symptom, with 77% saying they suffered from it. The good news is that for most people, these intense feelings will gradually lessen as the weeks and months go by, and you can help yourself by replacing negative thoughts with more positive, realistic thinking. Remember, the heart has amazing powers of recovery, and many people become stronger, fitter, and happier than they have been for years. You may also find it useful to watch the presentation on emotional well-being following a cardiac event, which is narrated by our team psychologist. Feeling these emotional, psychological, and physical responses to stress can be difficult and exhausting, and much of the time we will want to escape from these uncomfortable states of mind. Sometimes, just when we need to be taking extra good care of ourselves, we end up doing the opposite, becoming less active, eating unhealthy food, or drinking too much alcohol. This is known as the indirect effect of stress. To summarize so far, our fight or flight response when we are stressed can release chemicals into our bloodstream that have a negative effect on our heart and circulatory system. When we are feeling stressed, we may be more likely to turn to unhealthy habits. Feeling some stress is normal and can help our performance in some circumstances. The next slide looks at possible symptoms, and then we should look at management strategies. This slide shows some of the symptoms of chronic stress: headaches, muscle pain, low energy, insomnia, increased breathing, and increased heart rate. Often the signs of stress show up physically in our bodies without us even noticing. For example, we may shallow breathe, which can contribute to extreme tiredness, or the tension in our shoulders can cause neck pain and headaches. Stress can also induce blurred eyesight, indigestion pains, and even chest pain. Stress is often a leading cause of sleep issues. So what can we do to help ourselves? Thinking back to our autonomic nervous system, what we want to do is switch on the parasympathetic branch of the ANS as soon as possible, and this can be done by taking control of our breathing. When we take deep breaths, this engages the nerve that controls our heart rate, breathing rate, and other bodily responses that are normally automatic. We know we are breathing deeply when the inhalation forces our diaphragm downwards, pushing out the belly. When we are feeling acutely stressed, we tend to shallow breathe from the chest area. Taking a few minutes to do some slow, deep breathing will help our rest and digest response to kick in. Learning just one breathing technique is a good place to start when it comes to a quick fix relaxation. Here is a rectangle breathing technique. Inhale as you trace your eyes along the top of a door. Exhale as your eyes trace down one side of the door. Inhale as your eyes trace the bottom of the door. Exhale as your eyes trace the line back up to the top. If you can, engage your belly and repeat until you feel calm. There are plenty of other ways to enjoy relaxing and reducing your stress levels. For some, it might be spending time in nature. For others, it might be a formal yoga or Tai Chi class. Research shows that often after a cardiac event, the levels of adrenaline stay high for several weeks or months. Time doing formal relaxation techniques helps to bring these levels down. It is recommended that if you are feeling particularly stressed and anxious, you put at least 20 minutes aside every day to practice some kind of formal relaxation. If you would like further guidance on this, please ask your cardiac rehab professional. The benefits of relaxation are far-reaching. Research shows us that it lowers blood pressure, lowers heart rate, reduces the perception of chronic pain, can reduce angina symptoms, improves our sleep, boosts our immune response, and generally improves our well-being by boosting happy hormones. Regular exercise is probably the number one thing most of us could do more of to improve both our physical, mental, and emotional well-being. Further information on all the amazing benefits of exercise can be found in the video on exercise produced by our physiotherapy team in cardiac rehab. Another tool to help reduce stress is the practice of mindfulness. Mindfulness means maintaining a moment-by-moment awareness of our thoughts, feelings, bodily sensations, and surrounding environment. If we can tune our thoughts into the present moment rather than thinking about the past or imagining the future, this can give us a sense of well-being throughout the day. It is easy to be on autopilot, rushing through life without stopping to notice the small things. Think of a time when you have sat down to eat one of your favourite dinners whilst watching a programme on TV. 10 minutes later, your food has disappeared, but how much of the experience of eating and enjoying that food did you savour? Paying more attention to the present moment, to our thoughts and feelings, and to the world around us can help us enjoy life more. A 5-year study asked 201 patients with heart disease to do transcendental meditation for 15 minutes a day. The researchers found that this reduced the risk of death, heart attack, and stroke by 48%. These changes were associated with lower blood pressure and lower stress levels. More information on this study can be found on the British Heart Foundation website. Sleeping well has direct positive effects on our mental and physical health. Sleep plays a role in healing and repairing your heart and blood vessels. It helps us maintain a healthy weight, a good balance of hormones, as well as helping to control blood sugar levels. It helps with our brain function, and good sleep can reduce stress, mood swings, and depression. If you are having trouble with sleeping, please ask for a leaflet or handout on our top 10 tips on sleep, or check out the websites listed at the end of this presentation. We often find it helpful to talk problems through with a friend or family member, but sometimes moving forward can only be achieved by talking to a professional who is trained to help you deal with how you are feeling. These people are trained in helping anyone experiencing distress, and it doesn't always mean talking about the past. Some therapies focus solely on the here and now, challenging your thoughts and the way you look at things. If you feel that you need to talk with someone about how you are feeling, please speak with a member of your cardiac rehabilitation team or contact your GP. Following your cardiac event, it's important to take some time to reflect on what's important in your life and map out how you will prioritize your needs. Research tells us that hobbies and interests or volunteering can add to our general well-being and keep us positive. More information about voluntary projects can be found at the offices of Swansea Council Voluntary Service in Water Road. In summary, stress is a feeling of being overwhelmed or under pressure. Stress can be managed through prioritizing your needs, making time for exercise, making time for good sleep and relaxation, using tools such as mindfulness and meditation, or possibly using talking therapies. So this is your challenge. I leave you with the question, what one thing could you change to improve your well-being this week? Thank you for watching. What might help make you feel 10% more relaxed before you go to bed? Or what strategy might you use to feel less stressed and more confident before that important meeting you need to attend? Incorporating small changes into our everyday lives can have a big effect on our stress levels overall and help with general feelings of well-being. I wish you all the best on your rehab journey, and thank you for watching this presentation. If you have any feedback or further questions, then please contact the Cardiac Rehab team.